Hello, everybody, and thank you so very much for joining us in our webinar. So basically, I wanted to do a webinar for parents explaining spinal electrical stimulation. And Georgina is nice enough to join me, and many of you may know her. She is the mother of Flora, and she always posts these most wonderful insightful posts on her Instagram. So I think many of you probably follow her as well. So I thought it would be really good to have like both of our perspectives, like mine as the therapist and then Georgina's as the parent. So we are welcoming all of you, and just a few things. I have everybody unmuted and without the video, just because it makes it easier with connections. And we were thinking might be the easiest to put any kind of questions into the chat. So we can pick them up at the end of our presentation. So Georgina will look through them a little bit during the presentation as well. And if there's something that is just pertinent at that particular point of the presentation, she will interrupt me and kind of ask that question. But otherwise, we were thinking it might be the easiest to leave the questions for the end. Also, I want to stay away from being super specific for one specific child. I think that might be not the right frame here. You know, I think it's great to ask like general questions that might be interesting for everybody, but I will avoid just being super specific for one child. So you're going to see a lot of beautiful videos, and all the patients shown in the videos have given their permission for me to show these. So really briefly, and you probably know this anyway, the way I'm looking at spina bifida as a physical therapist, I'm basically thinking that the connection between the spinal cord, the nerves, and the muscles is impaired. So, you know, we have like an electrical signal that goes from the spinal cord to the muscle, and it might be weak or absent. And so the muscles are weak, but the muscle, there's nothing wrong with the muscles. The muscles are weak because the signal is weak. And I'm thinking about it like a phone connection. So the phone is working, but the information is incomplete or hard to understand because the signal is weak. So it's going to just do an example down here. So this is a child. This is with spinal stimulation on, and her feet are kind of tense. The muscles are tightening up. And then when mom stops spinal stimulation, you see that the feet are a lot more floppy. And then I'm actually going to be focusing in again when it comes on. You see the feet are getting tight. But then focusing in on the left one, do you see how it really pulls inwards? And this is exactly what I'm talking about with the nerve signal. So the signal that pulls the nerve, the foot inwards, is really strong. That nerve is really strong. But the nerve that pulls the foot outwards, the signal is really weak. So in her program, actually, we changed the electrodes to get a better placement and a better response with that. So I always test the children before we start. And so I basically can document when the muscles fire. I want to map out the sensation, and I want to be able to show objective progress. So to get an idea about the intensity, I'm looking for muscle twitching, and I'm looking for sensation at different intensities. So I slowly move up my intensity. So if I would test a person with an intact nervous system, they would show like muscle twitching or sensation at about 5 to 20 milliamps intensity. At 40 milliamps, it would be quite uncomfortable. At 60, it would be painful. And at 100, it would be extremely painful. So whenever I'm starting spinal electrical stimulation, I'm testing for the connection between the nerve and the muscle. And the way I do that is I have one electrode on the top and one on the bottom. I connect it with my unit, and then they have a hand switch. And I slowly go up with intensity, and then I push my hand switch and see if the person either twitches with the muscles or tells me that they feel something. And so for this little girl, I went all the way up to 100. And when I push the button, there is no feeling. I connected her foot with her spinal cord. So this is all on one channel. So the foot on the spinal cord, and the intensity is only at 10. So it's like a tenth of what it was before. And now see what happens when we push the hand switch. Here's the hand switch. Can you tell me where it tickles? Right there. Good job. So she can actually feel it. And to drive the point even further, so before when I had 2 electrodes on her foot, she couldn't feel it at 100. 100 would be extremely painful for us. She could not feel that. But when I'm connecting her foot with the spinal cord, I went down to 10 milliamps, which would be probably about the intensity where you and I could feel. And so for the first time in her life, she was able to feel her foot. And she was quite clear that when I pushed my hand switch, which is the moment when there's electricity on, that she could actually feel that. So this is another child. And you see the first testing when he first came and saw me. And then you're going to see him. The second part of that is after 3 months. And I apologize for the video for the second one, but it was just so good. I just had to post it. And go on. And whoop, it doesn't want to go. Well, look at this.
She was able to get the muscles to fire relatively quickly, which she said was great. But the sensation, she had it all the way up to 100 and he still couldn't feel anything. And she said for us, that would be almost unbearable. I think she said mega tickles. This really wasn't a surprise to us at all because we know that he doesn't have feeling in his feet. But her goal is for him to be able to have feeling and, if nothing else, for safety purposes.
So this was 3 months later now.
Tell me when I'm pushing it again, okay?
Thanks.
Yeah. Wow.
Yeah, that is crazy.
Oh,
That is amazing. Wow. Yeah.
He also felt today and hit his knee and he cried because he felt it. And
He has never been able to feel like he slammed his knee on the concrete. So,
yeah.
So basically, you know, at initial testing, he couldn't feel anything. And he didn't really respond to any pain when he fell and hit his knee. And this is 3 months later. And we had 2 electrodes on the foot. So top and bottom on the foot. Mom was pushing the hand switch. And at 20 milliamps, he was reliably saying that he could feel something. And then Dad was also explaining that he fell and hit his knee. He was actually crying, which is unusual for him. And I am so glad to hear that.
She was able to.
So then when I do the testing, I typically test 4 different sites. And I write down when the child was able to respond to sensation or when I saw twitching in that muscle. And I just retest every 3 to 6 months and keep that as my log. So then why do I test before I start treating? So one, it helps me to understand the intensity needed to get the muscles to start twitching. It gives me a knowledge of asymmetry. So if one leg, let's say, the quadriceps is much stronger on the right than the left, so I have that all recorded. It gives me knowledge of perceived sensation, so I know if the kids feel a lot or not. Also, that kind of gives me a good idea where I have to start with therapy. Then it gets the kids used to electrical stimulation. I'm a big fan of all of this. Has to be comfortable for the child, and it can never be scary. It can never be too much. It can never be painful. So it has to be comfortable, and they just get used to that because I'm just really slowly increasing intensity. It also gives me the chance to assess the skin's reaction to electrode and electrical stimulation. So the skin is kind of my barrier. So if I ever would have like too high intensity or that would be, I could actually burn the skin like a sunburn, which has happened a few times. It would heal like a sunburn. I can't burn the structures below. So I can't burn like the muscles. I can't burn the spinal cord, but I could burn the skin. And I think Georgina was going to say something about that.
What was I going to say, Gertie? I can't remember.
About the old electrodes.
Oh, well, oh yes, about the well, so the electrodes, which are these, it's really important not to overuse them. And I've got an example here of electrodes. Can you see me, Gertie?
I move it more into the middle, the electrode.
Okay. These electrodes are almost a week old. So we do spinal stim 3 times a day for 50 minutes. And you advised us, Gertie, to use them for 20 to 25 times. So using them 3 times a day, I find it's just easier to change them on the same day every week. So we get a week's use out of them. But you can see around the edges, they're just starting to get a little bit fluffy from clothes. And you've really got to watch out for that, because preventing burns is all to do with the quality of the electrodes and how well you look after them and how promptly you change them. So you really want to make sure that you keep those safe.
Right. And so the reason for that is when the electrodes are getting old, they don't stick everywhere. So the same amount of intensity goes into a smaller area. So if you before had like a 2 by 2 inch area where the intensity goes, where the electricity goes into the skin, you may, if half of that doesn't stick anymore, you have a much smaller area. So it's much more intense on the skin. Again, any kind of burns on the skin are extremely rare. And it would be kind of a redness, like a little sunburn that goes away within a couple of days.
Yeah, absolutely.
So,
and we have larger ones, don't we, Gertie, for areas that are potentially more sensitive.
Right. And the reason for that would be the bigger the electrode, the more the current is dispersed over a bigger area of the skin. So that is absolutely right. So where do I place my electrodes? On the back, I basically place them as low down as I can on the sacral spine, and then the next one finger above on the lumbar spine. And the reason for that is kind of on your right-hand side. So the right-hand side is a dermatome, which basically shows you which part of the spine innervates which part of the body. So if you're looking at my placement with the lower electrode, it would cover all the red area. So all the area that's marked red here, which is the sacral area. And the one in my upper part would actually cover all the area that is purple. And so with placing those 2 electrodes, I basically cover all the sensation and all the muscles of the lower legs. So I wanted to show you this chart on the left. I'm using a hand switch because it's more visible. Typically during therapy, we actually have it ramping up and ramping down. So it comes on slower and it ends slower. He's perfectly comfortable with that, but it seems like he jumps a little bit when she does that, but it's just because his muscles react so strongly. So you see when she's pushing the hand switch, he's extending his knees and he's bringing his legs together. Again, I have the other electrodes on his spine. And then I would like for you to kind of listen to what happens to this boy.
Here you see a 6-year-old boy with spina bifida level L4, L5. He practiced crawling pretty much all his life so far. Now you're going to see him after 4 weeks of spinal stimulation. You notice a big difference. His legs are staying under his body more, and he can pull them forward all by himself. The family was doing spinal stim 2 times a day for half an hour on the way to school while he was sitting in the car. And here, as a comparison, you're going to see him one more time, how he was crawling before starting spinal stim. Just
Pull these under you. Close them in. That's it. Pull the other one in towards your tummy.
So quite a big difference. And I just want you to know he didn't practice crawling with me, but because his muscles got stronger, he just could do it better, so he was able to just fire the muscles he needed to fire when he needed to crawl.
Gertie, how long had he been using spinal stim?
I think this was like 3 months later.
That's really fast for such a great reaction, isn't it?
Especially,
And,
he's 6 years old, and both parents are teachers, so they had the electrical stimulation on in the car while he was driving to school and when he was coming back. So it worked pretty well for their routine as well.
mhm.
Okay, and we're getting to the next one.
Here you
Okay, and then other placements, for example, I often have electrodes somewhere on the bottom, so I can have them for hip extension. Very often I do need hip extension. I can have it a little bit more on the outside to help for hip dysplasia. So there's a muscle, the gluteus medius, that kind of helps more to pull the head into the socket. And then sometimes I have them close to the anus to help the sphincter to close. So I ask parents if there's an issue with like fecal smearing. And if it is, then that is another placement I can do. So then here you see this girl. She typically always has her left leg turned inwards, both the lower leg and the upper part of the leg. And so I really want to address that because over time you would get a bony deformity. And here you're gonna see her with the e-stim on. And again, I have a hand switch, so it kind of makes her jump here for a second. So this is when I'm pushing. So I'm getting her gluteus muscle that turns the leg out. That's what I wanted to. And you see how beautiful she turns her lower leg out as well. And it stays in that position until we let go of the hand switch. And then the foot is gonna fall back inwards like it does right here.
And Gertie, that's a great time for me to mention that. So you mentioned the risk of a bony deformity, and that's one of the great things about spinal stim is we're able to mitigate future problems such as growth. Sorry, that's someone trying to call. Yeah, so growth and deformities and things like that.
Yes, and so the part is, like the way she was sitting, if the foot always pulls inward, that over time, actually the bones can go into that direction. And that is much, much harder to address. If it is like muscles and joints, it's easier to address, but the bony deformity is really, really hard to address. And I mean, if it's really severe, it needs to be surgically addressed. So we're trying to avoid that.
And I know with Flora, she had really severe hip dysplasia, and the consultant wanted to do open reduction surgery. Really didn't want that, and having the help of the spinal stim to strengthen those muscles, she's developing a hip socket, which is incredible because we all want to avoid any surgery that we don't have to do, and having this empowering way to help affect change is really helpful.
Right, I agree with you. So the hip dysplasia is a big, big issue. I've had 2 kids so far where one had a dislocated hip and one had pretty significant hip dysplasia. And we had an X-ray before and then after 6 months. And for both of them, the hips are seated now. They were both younger kids, they were less than 2 years old. But it can have a positive impact.
Mm-hmm.
So then here, I wanted to show you the opposite. So this child actually has her legs turned outwards. And so a lot of children may have club feet and they get like a dog's bar, and it just really turns the legs out. And I needed to a left foot to kind of be straight. So you're gonna see here in just a second, okay, here e-stim is on, and you see how she just turns her lower leg because I only needed the lower leg. So she turns her lower leg straight and holds it right there. So that's how I was treating that external rotation. And it really did make quite a big difference in the way she is moving and walking. So this is a child who has, I think his level is like a L3, L4, but he also does have a scoliosis. And here I'm having like the upper spinal stimulation. So I have like large electrodes and I move them all the way up. So here you're going to see me push, and you see how straight he's getting, and his head is getting all the way straight, and he's sitting up much better. And then when I let go, then he's going to fall out to the side again, and his head is going to fall back again. See that? Okay. And now I'm going to push again. The head is coming forward. He's getting much, much straighter, and he gets into a really good position. So treating scoliosis and addressing scoliosis is extremely important. I think scoliosis with hip dysplasia are two of those major surgeries that many of children with spina bifida have. They can be quite impacting their lives. So here is another child. I actually have 4 electrodes. You don't see the 4th one because it's in the diaper. So this is electricity on. And this was the first time I was seeing him, you know, so he was a kid that was always slouched over. So this is when it's on, he's sitting nice and tall. And I was trying to show it from the front. So he's sitting fairly tall, and then he is sitting up. He's doing pretty awesome. And then when electricity comes off, he's kind of hanging forward like he normally does. You know, that's kind of how he normally watches TV, kind of hangs his head back and just sits there. And then here's electricity coming back on. So I don't tell him anything. It's just, you know, the facilitation in his back that kind of gets him up, sitting tall. And he goes back down. So how is the therapy done? So this is my ideal. So would be done daily at home, like 1 to 3 times by the parents. This is beautiful floor. You see right here. Preferably the kids are active, like standing, walking, crawling. She has like this cute little backpack on there. But it can also be done while the kids are eating or sitting in the car, like my other little boy, or the stroller. And then in terms of frequency for me to see the kids, initially I see the parents every 2 weeks, probably for the first 3 times. And then later I see them monthly or every other month, or like Georgina and I, we probably meet only every 3 or 4 months now, because she has a program that works quite well. And
yeah, and I can identify now when she needs a little of the intensity dropping off, because I you know, it becomes apparent when she can she's gained some sensation, and then we know we need to slightly reduce the intensity, and that gives us a bit of time to wait until we can arrange a meeting with you. So you get to learn how to, you know, work it all out for yourself a little bit.
see, and I love to have the parents as partners in this. So my parents know exactly what I'm looking for. They know exactly what is a positive response, or, you know, when Georgina says, get a little bit down with intensity, so it may not feel good anymore, or because the muscles are getting stronger and stronger, the muscle contractions get so strong that we just have to reduce the intensity a little bit to not have them quite as strong. So typically, the parents are really, really well educated when they need my help, or when they can just keep on going without my help. So then here you're gonna see a child. This is again, he's just playing, and he's just like walking back and forth, and he has the Easton on his abdominals. So what you're seeing there on the left is kind of the placement that he would have, and he's just kind of walking around playing. I put it on abdominals because he really arches his back, and I want to make sure he doesn't have back pain in the future. So he just has it on for quite a while, and he just does whatever he would normally do without the Easton. So it doesn't intrude on time as much as some other therapies. You stick the electrodes on, and then you are pretty much good with that. So improvements often seen within 6 weeks, increased circulation, new movements, strengthening of existing muscles, faster motility, less constipation, and increased sensation. And actually the faster motility was actually Georgina who told me about that. You want to say something about the test that you did?
Oh, what with the pinprick? Is
No,
that
with the contest, you know,
the corn test, sorry. The girls were just distracting me. Yeah, you could, because corn doesn't fully digest, and it's a very obvious thing to notice. You can use it to track the length of gut motility, so that's quite helpful, and we've seen quite an improvement in that since using spinal stim. So it's great to know that things aren't sitting around for longer than they need to.
Right. So initially you were saying it took about 3 days, And now she's at about like a day and a half before she
Yeah,
passes her school.
absolutely. Yeah.
So then the other thing is, increased circulation, and I get like these beautiful little videos from my parents. We can see like before this child didn't feel anything, and then mom was saying, look at this, now she is responding. So improvement in sensation would be something that I do expect pretty much with all the kids I'm working within a fairly small time frame. So this was 6 weeks for this child.
Yeah, and feeling noticing improved sensation is one of the most exciting things as a parent to see. I just can't even express how exciting it is when you've had no sensation and then to notice. So I've posted today removing Flora's kinesio tape that you taught us how to use, and she at the beginning would feel absolutely nothing on her L4, L5 dermatome regions of her legs. And not that you want your child to be in pain, but she notices straight away that I start to peel it off, and it's just incredible and something to be really thankful for. So that's amazing.
Yeah. All right. So let me start this one here.
This girl was 18 months old when we started spinal electrical stimulation. She has level L3, L4 spina bifida. She was unable to stand. She didn't know how to push her legs into the ground and was too weak to extend her hips and knees. 8 weeks later, you see her standing up tall. Her hips and knees are extended. The family did spinal electrical stimulation an astonishing 4 to 5 times a day while she was eating or playing or standing. Again, this is what she looked 8 weeks before, and here she is 8 weeks later, standing up tall. By doing electrical stimulation, we strengthened not only her muscles, but also gave her better sensation, so she had a better sense where she was in space.
So she was quite amazing. And I think those parents taught me that more is better. Normally I was saying, well, do it like 1 time a day and perhaps take off Saturday or Sunday. I think this particular family just has taught me that more is better if it's realistic in your life, so they really pushed it, and she showed incredible change very quickly.
Yeah,
so then,
and putting the electrodes on and off is the thing that sort of you have to stop and do. So the length of time that the stim is on, as long as they're playing or you're traveling, that doesn't really matter, because we do 50 minutes 3 times a day, don't we? And it's not a problem at all. It's very easy to fit in. It's good to have a routine, but it's the taking on and off that is the thing that you have to stop to do.
right, and we're gonna see like a little video of you doing this here in just a minute. And so possible effects over time would be reduced hip dysplasia, and then muscles responding in areas that were unresponsive at initial testing. So I told you I always kind of test those different areas, and then we retest. And so we can actually have actual numbers saying, okay, before muscle did not fire at 100 milliamps, and now they fire at 50. So we can actually document that. Some children develop urinary continence, and I know parents are super, super excited about that. I get very excited about it too, but not all my kids do that. Probably I would say perhaps about 30%. And it's a little bit harder for me to fine tune that because I can't see what's going on in the urinary tract and everything. So it came as a surprise that this is happening, and parents were reporting about it. And some parents have like less pressure in the bladder. So they went from a hostile bladder to a normal bladder pressure. And I know it is really super important. I try to gain more and more experience, and I think eventually I hope to be connecting with a urologist so I can kind of have that more specific knowledge of somebody in that area to kind of help me to make it hopefully even more successful. Then less fecal smearing. So I was talking earlier about the placement on the bottom, that I can actually place my electrodes closer towards the anus, and that could actually help with that muscle just getting stronger. And with that, you would have less smearing. improved motor function, like you saw with my little 6-year-old, that was just, he was crawling better because he had the muscles, not because he practiced more. He had the muscles and he had the nerve connection. And then reduced asymmetry, right versus left leg. And I bet a lot of you know, like your child is better on the quadriceps on the left and on the hip extension on the right. And so typically there always is asymmetry, and it's not always that one leg is all strong and one leg is all weak. Typically you have a combination of the two, one being stronger in one area and one being stronger in another area. And then because I have better circulation, so typically circulation happens within the first 6 weeks, that people tell me, oh, now the feet are not cold anymore. I get faster healing and I get less whoop and I get less fungus between the toes. And you were going to say something about that too, Georgina?
About the
Circulation. Didn't you say you wanted to say something about circulation and amputation in adults?
Oh yes, so as a parent who needs to know everything, I was researching and I was learning about lives of adults with spina bifida, and it's easy to scare yourself, but I was noticing a pattern of people reporting toe amputations, lower leg amputations, and that's something, you know, it's hard to face the future, but we all want to mitigate the impacts. We've talked about scoliosis and hip dysplasia, but you know, this is something we need to be aware of and to improve, and improving the circulation is the major contributing factor to reducing the risk of someone needing amputation in later life. So knowing that you're able to empower yourself to help prevent these things happen in the future is great.
Yeah, I totally couldn't agree more. So this is a little child. The father contacted me the day she was born. And when she was 3 months old, we started spinal stim. And so initially she was so weak, you didn't really see much. But then over time, we kind of saw some more pattern of asymmetry. So I want you to see the asymmetry. And then we are actually changing intensity. So we just make it less intense on the stronger leg and more intense on the weaker leg. And then you see how she responds with that.
I'm just noticing how much more extended this leg is than this one. Like I knew they were always sort of a bit different than each other, but this one's seeming like this muscle is still a lot stronger. And I wonder if that's okay about the.
So this is when the ischium comes on. That's when the legs come together.
This is on the feet right now.
And then, so this is when it comes on.
So that's now it's 73 and 50. So 73 and 50.
So you can see now how she's much more.
Pretty even, eh? Let's watch one more time.
So this is her normal movements. Her legs are always really, really wide. And so then you can see the machine is coming on, legs are coming together.
Go, Chattanooga, go.
And you see how she looks a lot more symmetrical. So I have that beautiful ability to just have more intensity in the weak part of the body and more intensity on the part that needs more intensity. So I can fine tune that pretty well. Okay, this is a child that has a really high level. His level is at T10. He was actually the first child I've been doing spinal electrical stimulation with. He's doing this now since 5 years. He's gained more trunk control, but he has not gained control over his legs. You're gonna see when I start the stim, you see how strong his legs kind of contract, you know, all his muscles, even strong enough, you know, when I try and move his foot, when it comes back on, I can't move the foot because his muscles are so strong that I can't move it at all. And then here I can move it when it's off again. I was going to show you from the top. And so I want you to notice what his legs look like. So he has been doing this since he's 6 months old. His legs have normal lengths. They have normal circumference because he doesn't have muscle wasting. He's using his muscles while we're using the spinal stim. So while we are not able to have him connected yet that he can use his muscles, I get the circulation, I get his normal lengths in his legs, I get his normal circumference. And my honest belief is that in his lifetime that some medical advance will be able to kind of connect his spinal cord with his nerves, so he would be able to use his legs. And when that time comes, he has everything he needs to have for that. So then I was talking about a child developing muscles she didn't have.
This is little Ava. She has level L2 spina bifida. This is what she looked like before we started spinal electrical stimulation. The hip muscles are so weak that she can't sit up, and she's leaning forward and supporting on her arms. This is Ava 2 months later. You can see that she's sitting a lot taller and is a lot more stable because her hip muscles have gotten stronger, and so she's able.
Good job, well done. Look at that, well done.
Here you see little Ava before we
Before we started, okay. So for children, so she had a level L2 spina bifida, so for her to develop hip muscles to push the legs into the ground, being able to sit up was kind of a big deal. And for her, it just took 8 weeks to kind of get that. So that was really beautiful to see. So possible effects of upper spinal stimulation, so that's when I have the electrodes on the spine, is increased respiration, decreased respiratory illnesses. So my little boy I showed earlier with the T10 injury, he used to be in the hospital a lot in the winter months with one respiratory illness after the next, and is not anymore, you know, and he has increased coughing force so he can get the mucus out, better trunk extension and trunk stability, increased abdominal functioning, and preventing or slowing down from scoliosis.
And Gertie, this is one of the questions I get asked an awful lot, is because it's a common misconception, isn't it, that upper spinal stim can only help children with lower leg paresis. So as you've just explained, it's for the benefits are there for whatever level the spina bifida is at.
Right. Like for Brody, he did not have any function of his abdominals, so he couldn't even hold his head. So we were able to get, you know, him being able to use his abdominals and his back extensors. So we got new movements in that way. We just haven't been able to connect his legs. But yes, absolutely. Or you saw the other little boy with that scoliosis. It's so hard to treat scoliosis because it's so hard to kind of tell a child, like, tighten up here and move over there and hold this. So with my electrodes, I can be extremely specific where I want to have the movements, and I can just place them there. And like for this particular child, he just had it on for like 45 minutes. And so he would do a lot of exercise during that time, and he just plays and eats and is on the floor. So it's very functional. So this is an 11-year-old child, and I think his level is like L3, L4. And so you see him initially, and you see he's kind of quite wobbly with his hands off the ground. You know, kind of hard for him to kind of keep his balance. And you're going to see him 3 months later. He looks quite different because he got his haircut. But do you see how much more stable he is in his trunk? And he's actually able to kind of turn his trunk side to side. And it's even more significant. This is his lordosis. So you see that blue line? I just followed his spine. A huge lordosis, a huge kyphosis. So in order to being able to rotate side to side, you actually have to be taller. So he was kind of able to extend his trunk taller. This is him before, and then you're going to see him one more time afterwards. So he can just be taller in his trunk, so he can do all this rotation. So it kind of help with that kypholordosis as well.
And someone's just asked, Gertie, if we stop the treatment, will the condition get any worse? And I think I'd be right in saying by doing the treatment, you're mitigating. So by stopping it, you're simply removing the benefit of the treatment. Is that right?
Yes and no. So I find like whatever movement they have gained, like that little girl that was sitting and she couldn't sit up tall. So now she can sit up tall. And even if you stop the stimulation, she will still be able to sit up tall because that nerve connection has been made.
Okay. This is neuroplasticity. So you've made a new connection between the spinal cord and the destination.
Right. Right. You got
So that benefit can't be lost once you've achieved it.
I have not noticed that to be being lost, but what you can lose is strengths. And it's basically, it's use it or lose it for all of us.
Mm.
You know, so if you and I do a lot of exercise and then we stop doing that exercise and we don't replace it with some other exercise, then we will lose that extra strength we gained.
Yeah.
So like for
the spinal stim is a workout for the muscles. That's how you're gaining the strength in the muscles.
right. It's yes, a totally is a workout. It's actually quite the workout.
Yes.
And the advantage with the spinal stim is you're activating all the leg muscles at the same time. So it's all the muscles of the lower leg activate at the same time. But wherever I have my electrodes is like the most intense activation. But you still do all the muscles at the same time. So it's quite efficient.
Flora wants to join us. I'm just going to grab her.
Okay, then here you see like a little 9-month-old child, and she couldn't bear any weight on her legs. And I don't wait till kids get older. You know, I don't know why. So basically, I have electrodes on her thigh muscle, on her quadriceps for knee extension, and on her bottom for hip extension. And so as she is loading her legs, I'm pushing my hand switch. So I'm kicking in those muscles. Just like a really short time. We probably did that like, I don't know, 5, 6, 7 times till she kind of understood how to kind of push her legs into the ground. Still looks better with electrical stimulation on, but I think it was quite amazing how quickly she did that. And she's 9 months here. Old. So I don't, other kids do this at 9 months. I wanted her to do that.
Oh, I want that one.
So who can do spinal stimulation? It's basically persons with spina bifida, spinal cord injury, or other motor problems. I can start as early as 3 months old, as long as the scar has healed. If you have spina bifida and you had like the surgery for the myelomeningocele, the earlier you start, the better. And part for that is, you know, sometimes when I see older kids, they already have a lot more asymmetry, or they have started like using substitute movements. If I start earlier, I perhaps could be able to change that where that wouldn't be as much of an issue. I don't know the upper age limit. You know, my oldest child so far was 13 years old, and within 3 weeks, he actually was able to kind of flex his toes, which he wasn't able to do before. His level was like a S1, and so his toes were like always up and flexed, and within 3 weeks he learned how to flex them down. You know, he could bend them down, which he wasn't able to do before. But I haven't treated adults with spina bifida yet, so I really don't know if there is an upper age benefit. I would think since we get better when we exercise, why shouldn't people with spina bifida get better when they exercise when they are older?
And
so
someone asked, can you use spinal stim with an adjustable shunt? Gertie, this is a good time to answer that.
Right, and that actually that leads me right into the next one. So spinal stimulation can be done with most spinal cysts, unless there's something unusual. I don't know. You know, that would be question to the doctor. And the VP shunt, even if they are programmable. So a programmable VP shunt is a magnetic. You know, it will be programmed over a magnetic field. And the magnetic field for my e-stim is very small. It's kind of less than in a phone, and I don't have the machine anywhere close to the shunt. So I've asked several of the neurosurgeons, and none had any issues with that, and I haven't seen anything happening with that either. And then also metal foam surgeries. You know, I do have kids that have like rods for scoliosis, or they got like metal in their hips from hip surgeries. You can do spinal stim or electrical stimulation over the metal. So spinal stimulation cannot be done if you have a pacemaker, a VNS, or anything implanted that it's electronically controlled. So magnetically controlled is not an issue, but electronically controlled, I can't do spinal stim unless the surgeon would specifically say I could. And the other one would be pregnancy and cancer. So it would be the other two limitations I have.
And we've had a question, Gertie, are there any negative effects? But I think we've covered that with the skin, haven't we? That's really the only.
The skin is really the only one. And as I said, I never go to anything that's painful. So I always stay within comfort for the child. So that would be kind of your two negative factors. Otherwise, we have not noticed anything else negative. I've seen 140 children so far with spina bifida and treated them. And besides that, that hasn't been an issue. Okay, so this is what Georgina is going to tell us what's going on here.
Really to illustrate how easy it is to go about putting your stim on. So we have two of the smaller electrodes, which I'm putting on the base of Flora's spine here while she wriggles. You get the knack for managing to hold on to the child and place everything without too many problems. I'm usually having the wires pointing out either side because then they're going to connect with either leg, and that makes it a bit easier. We're using our larger electrodes on her legs because she tends to have a bit more sensitivity now, and so by using those bigger electrodes, we're spreading out the impact of the electrical impulse, making it less noticeable for her. So we're just putting those on. These are specific sites that Gertie has helped us choose to give her the maximum benefits for her. Hello. And we have hip dysplasia on Flora's right side. So Gertie has a program for us where we always have a higher intensity on the right, which has massively helped reduce the disparity between the two sides. It's fantastic. And here I'm just plugging in the wires, the electrodes. You always have your red on the limb, and the black ones have to be the ones over the scar, don't they, Gertie, over the spine?
Right.
So I'm just finishing up that. So this is just the normal 3 times a day how we put them on.
Some people may be intimidated by it, but wouldn't you say it's fairly straightforward once you know the placement?
It just becomes part of your everyday routine. It's like boiling a kettle, putting a tea bag in and making a cup of tea. It's just really easy and you do it without even thinking. So you have a right and a left, and so this is how Gertie can really target the muscles that need more help, maybe on one side than the other. So here I'm just
that one's a bit high. 7 on that
filling
side.
up the intensity. So on this part of Flora's leg, we have 27 on her stronger side and 30 on her weaker side.
There we go.
And then on her glutes, we go right up to 45 or 50 on either side. So there's quite a difference, and that's all depending with and her sensation and the need for activation. So it's different on all the different sites that you might want to put electrodes. We started off doing the feet, didn't we, Gertie, when she was a baby, and we've gradually moved up to where, as she's gained more and more strength and sensation, we've moved the sites to where we think they're going to give her the most use.
See, I want you to also see how comfortable Flora is, you know, so she has her everything on and she's ready to go and play.
Yeah, and we pop her stim unit into a little backpack, and then she just gets on with whatever she wants to do. She's not bothered about it at all. It's comfortable. It's not heavy to carry. We quite often use it for while she's in her high chair having meals or on car journeys. That's a good one. But yeah, just okay. Today it's not at all.
Does that feel comfortable, Flora?
See, and I
Good girl.
I timed it and it took like 3 minutes and 20 seconds. So I do want to honor everybody's time constraints, you know, and asking parents to do more. I am, know that a lot of you probably have super busy days. I think so, and that's the feedback I'm getting from a lot of parents. It's pretty time efficient because you get electrodes on and then they're on, and then for the next 50 minutes for her, they will do the job, and then you get them off, and that's the end of the treatment.
Yeah, and the way that I try and think about it is certainly not as a chore, but that every single time I put those electrodes on, I'm empowering myself to be able to help Flora, and that feeling of hope, Gertie, is what we need as parents. We need to feel like we're doing something constructive to help their futures, help everything, mitigate problems for the future, to give them as much mobility as they can possibly get. It is so empowering, and from I've been talking about mother's mental health lately, and I think it's, for me, finding you and starting this was a huge boost to my mental health, because it empowered me, and that's a huge bonus too. It's not just about the child, actually, it's about the whole family.
Yeah, I'm glad to hear that. Yeah, it's super important. That.
That's
So
what
after treating more than 130 patients with spina bifida, here are my limitations. So when I have a symptomatic tethered cord or a symptomatic Chiari malformation, symptomatic meaning that they have issues. I mean, most kids with spina bifida have Chiari, and most kids, or all kids with spina bifida, have a tethered cord. As long as it's not symptomatic, I can help. But if it is symptomatic, then it's just time to get that addressed first and then continue with spinal stim. Then hypersensitivity, which is rare. I think so far I've had 5 kids where I could just never go up high enough with the intensity to get a motor response. So they were just so sensitive that they just didn't let me go up high enough to kind of get the desired motor response. And then the next one would be too little or infrequent inputs. So I can't do the magic if, the e-stim isn't on, so I know some people are really super excited and they get started, and then life happens and they do it less and less frequently, and then they don't see the change, and then that motivates them even less to continue, and I think it just goes down from there. So I see the best success when therapy is done 1 to 3 times a day, or some people like Georgina have it on for a long time, almost 3 hours a day. Or my other family, they have like different sites, so they have 4 to 5 times a day. They kind of just change the electrodes at different placements. So you basically, I think it's like practicing pianos. The more you practice, the faster you get better, and that would be true for the spinal stim as well. So the cost, the initial cost is high. So the unit costs $420. Plus the shipping, internationally or within the United States. And then for international shipping, there can be also costs for custom. The electrodes cost about like $20 to $30 a month. The first session, including like the testing and the initial setup, which will take me about like an hour and a half, costs about $180. And the follow-up sessions are $95. So initially kids are seen like every 2 weeks. And after 2 to 3 sessions, follow-ups of monthly, and later on they're every 2 to 4 months as needed. So I always leave it up to the parents when they need me again. They just reach out to me and say, okay, can we have another session, please? So I think once it's established, it's very cost and time effective, but the initial cost is certainly there. I know we were talking about a cheaper unit. So I feel pretty strongly about the unit I'm using for a couple of reasons. Number one, it has some safety features that many other units do not. And that is, for example, you have 2 electrodes. So when one comes off, the whole channel shuts down so that there's nothing on there. For a lot of units, when one electrode comes off accidentally, double the intensity would go into the remaining electrode, which would be a pretty good way to kind of burn your skin, I think. And then the other part is, it always locks down the intensity. So you actually have to unlock the intensity to go up higher. So if you have any kind of siblings that like to play with the e-stim or the kit itself, you actually have to actively unlock the e-stim to go up higher with intensity. And the third reason is really, I know this unit really well, so I can help you with any problems you may have. If there's another unit that I don't have and I don't know, then I don't really understand what's going on as well as I do with this one. So making spinal stimulation cheaper, the other possibility would be for you to get your physical therapist trained. So I have a really good 4-hour online training course for therapists. And I think after that course, many feel kind of that they have enough knowledge to kind of get started with their family. I've had families that have done fundraisers or GoFundMes. Perhaps somebody's interested to do a foundation. I don't know. I didn't know if you wanted to say something there.
Yes, I'd love to say something. So one of the things that we've really appreciated from you, Gertie, is your unparalleled knowledge about helping children with spina bifida. You must be the person in the world that knows more than anybody else and has seen more cases of pediatric spina bifida. And so, you know, when I think about what Flora has achieved it's not just since we started using spinal stim, it's since we met you. And that's because you are able to spot these intricate things that a regular physiotherapist could miss, or that a parent could certainly miss. So you knew when Flora's orthotics weren't right, whereas I didn't. And you noticed things about her gait, and you knew that kinesio tape would help her. And that there's been lots of instances of that. So from my perspective, Gertie's too modest to say anything, but from my perspective, having Gertie on your team is unparalleled. You just can't do better for your child, because she's not only going to teach you about spinal stim, she's going to notice these little things that add up to make the biggest difference. And Flora is able to walk, and it's because of Gertie. So so thank you.
Thank you. That is yeah, and you know, so the timing for this introduction was also a little bit driven by Georgina, because I was saying, you know, shall we do this after Christmas? You know, life is not as busy afterwards. And she was saying, no, why don't we do it before? Because perhaps there are some grandparents or some other family members that want to kind of help with the purchase of like an eStim unit or something like that.
Yeah.
So
and certainly had help, Gertie, when we bought the Hypervibe that you suggested, which is another example of something you've helped us with. You know, families we all want the best, don't we, for our children, but there are so many things that extra costs with having a disabled child. And so I think yeah, it's a great opportunity this time of year to ask for help getting something really meaningful.
yeah. So I want to thank you very much for your interest, and I'm very passionate about spinal stimulation. And you can see that again with this little kid, you know, you see him without the stimulation on, and then on the right side, just look at all his muscles, his shoulder muscles, his trunk muscles, you know, everything is kicked in. And it just happens automatically because of my stimulation. So I find it very effective and fairly easy way of treatment. And yeah, Georgina and I are ready for questions. So I think you're gonna read some from the chat.
Yeah, got a few. Someone asked, can you use 2 units at once to let me just check on that. But in theory, could you use 2 units at the same time targeting both upper and lower areas?
You can, and I have. I don't think that's the usual thing to do. So I think you're really good if you get one.
Yeah. Okay. And can the costs be covered by insurance? This is a question for those in the US.
You know, and unfortunately, not if you see me, because I'm in Florida and I would be out of network for any kind of person to come here. So I've tried with insurance billing, it's a nightmare, and don't get reimbursed. So what I do for people that come here and see me, I always write a bill that people can submit to their insurance. But if insurance pays or not, I do not know. I also know that people have tried to get the eStim through insurance. A few have been successful, many have not been successful.
And someone asked, are your appointments typically virtual? Well, I can say we're over here in the UK and you're in Florida, Gertie, and we have never met yet, but we hope to remedy that, don't we, soon? So it's entirely possible to do all the treatments virtually and get all the benefits.
Right.
I know, so ironically, it can be easier for you, Gertie, to work with people in other countries, can't it, than the US, because of your different laws in different states of America.
So United States is very strict and very clear. So I have a license in Florida and I have a license in Missouri, and that's where I can see people online and in person. And then otherwise people would have to come here and see me. I have a license to practice in Germany. And so with that, I can practice in the 27 countries of the European community. So I can see people online, outside of the US.
Yeah,
and it works pretty well with online sessions, I would have to say. I think a lot of us had to go through COVID and do online therapy, and some of that I saw was pretty tough. I think spinal stim, because it's so straightforward, I think it's an easier one to be done.
Yeah, and we first started off with the help of our chiropractor, who was really, really supportive of the whole concept and helped me research it, because we were one of the first, weren't we, to start. And also, but then we now sometimes do sessions with the help of a physical therapist who comes here, and I find that really useful, having the three of us, so you, Gertie, and then me and our physical therapist, because there's certain things that only she really understands the way you're explaining it in a professional way. So that can be a really helpful addition to the whole thing, is just getting you and our physical therapist to work together.
Right.
Are there any negative effects? I think we've covered that. Someone wants to know about frequency and pulse width, but I think that's more of a professional question, probably not something you would want to get into now. Where to put the electrodes for hip dysplasia? Perhaps they missed the beginning. Someone else has asked, apologies if I missed this, have there been any improvements on dislocated hips, and if so, which way? So we were talking about the difference between dislocated hips and dysplasia, weren't we, when we were chatting the other day? Would you mind just recapping on that?
So there have been improvements with kids with hip dysplasia, or even one with dislocated hips, but he was a young kid, so he was 9 months old when he came, and so he had his hip completely dislocated. And when they did a re-screen after like 3 months, the hip was seated, and it's still seated after 9 months later. So yeah. Can I promise that for all kids? No, but I know, like, the placements, you basically, like, on the side of the hip, the glute medius would be the placement I would do for that. And those are the muscles that kind of pull the hip into the socket.
Okay. So we have a question: when the muscles are getting stronger and new connections are built, so the child will be able to do new moves, aren't these moves enough to preserve the progresses even if we stop the treatment? And you've kind of answered that, haven't you?
Right. And the other thing that's actually really cool is they have done some experiments on physical therapy students. So they basically put electrodes like on the thigh muscle, on the quadriceps muscle, and then put them into MRI. And when they were activating that muscle, they could actually see the part in the brain that normally activates that quadriceps muscle. So you're basically getting the connection between the brain, the spinal cord, and the muscle. So it activates both in the distance, on the leg, but it also activates the brain at the same time.
Okay. And do you deliver to Europe? And the answer to that is
yes. I do send the Eastern unit to Europe. Actually, I just yesterday got my website ready at spinalstim.net, and I can put that in the chat so people can get into that, and kind of you need to have more information, like how to get something, where to get something, or how to get started. It would be all on my website.
Okay, fantastic. Will a recording be available of today's session? Absolutely.
Yes, yes, it is recording, and I will send a recording I will send a link out for the recording, and then if somebody needs to have the link specifically, then you can just kind of try and contact me.
Okay, and will this help for my child who's having only bowel and bladder incontinence? His injury is S3. So if there's no problems with mobility, there's still potential to help with bowel and bladder incontinence, but
Well,
you can't
I do have
guarantee.
some kids that came specifically for that to see me, and I always caution, you know, I say I hope it will help, and it has helped some of my kids, but not all of my kids, you know. So I've had several families where it did work, but I also had some where it didn't work. So I can't promise, but I can pretty much promise you that sensation will get better, and you will have more strengths that I have seen in all the kids, and circulation gets better. The bowel and bladder part happens for some kids, but not for all.
And one question that I've had that I've asked that I think other parents might wonder about is, do you see any different results in children who've had fetal surgery versus those who haven't, who had surgery after birth?
You know, it's interesting. I always ask that question, and I'm kind of trying to see if there are patterns, and they are not as clear as I thought they would be, you know. So they often, kids with fetal surgery do present better than their level, but sometimes they don't. Or I just had like a child that had closure after surgery, after birth, and her level is like a L4, and she looks amazing, you know. And so I don't think it makes it different in terms of doing spinal stim or how effective spinal stim is. So I basically treat what I see, and the level doesn't matter, or if they had surgery before or after doesn't matter either.
Okay, that's really great. Will this treatment help to loosen a tightened PSOAS muscle? Sorry, I don't know if that's a word or
Yes.
abbreviation.
So what happens often, that's why I showed you earlier with the foot, you know, that you have like some nerves that are really active, and that's why it tightens the muscle, right? So the nerve kind of is super active in one direction, but not in the opposite direction. So with spinal stim, we are really trying to get like more of a balance so that both muscles become like similar strengths. Does it work 100%? No, but that's kind of the goal, you know. Like for this little kid with the foot pulling inwards, I will always have my electrodes on the outside to kind of help strengthen that nerve that kind of activates the foot pulling outwards.
Okay, so for this baby, she's arching her back when she's lying down, so that will hopefully help to relax the muscles that are tight and strengthen the ones that are preventing lying flat. Yeah. Okay, great. Let me just have a quick check. So someone had asked, once you've got a good routine set up, how often should you have the follow-up meetings? Oh, and I think you said like we only have sort of every 3 or 4 months, don't we? So that answers that. The ideal time to start, we've covered that, as basically as soon as the scar recovers, but that's not to say that you shouldn't start if your child is older, because there's still so much to gain. Would you agree?
Yes, I would totally agree. You know, I sometimes, because I guess I'm posting more little babies than older kids, because sometimes older kids choose not to be, you know, on video. But I totally agree that, you know, there's not like the cutoff that was if you like 2 or 3 or 5 that you can't do it anymore.
And where to put electrodes for hip dysplasia? I guess you would cover that on your one-to-one.
Right. And so somebody was asking where in Florida I am. I'm in Jacksonville, so it's about 2.5 hours away from Orlando. People often like to combine the coming and see me with going to Disney. So I'm close to Jacksonville, Florida. That's
I think that's all.
I think we are good for now.
I hope we've covered everything.
So I want to thank all of you for your interest, and I hope we covered like the main points of that. As I said, I just put up a website, and I will have this recording in the website. I have a brochure in the website, everything we covered here. So you would be able to see all of that too. and hopefully kind of decide if this is something you want to do with your child or not. Yes. So thank you, everybody, and have a great day.
Thank you, Gertie. Bye.
Bye.
Mhm.